Hello everyone. Today I want to talk about stem cells and Parkinson's disease. Many people ask, is this a cure? Should I travel for treatment? Is this available now? Let's go through the facts calmly and clearly. In Parkinson's disease, brain cells that make dopamine slowly die. Dopamine helps control movement. The idea behind stem cell therapy is simple. Replace the lost dopamine cells with new healthy ones. That sounds promising, but we must look at the evidence. There are two main types of stem cell treatments being discussed. This involves brain surgery. Doctors place lab-grown dopamine cells into the brain. The goal is for those cells to survive and produce dopamine. This is serious neurosurgery. It is only done in research studies. This is very different. Some clinics inject stem cells into a vein in the arm. They claim the cells travel to the brain and repair damage. We will talk about that claim later. Let's look at real published research. In 2025, a study led by Dr. Viviane Tabar and colleagues was published in the journal Nature. This study tested lab-grown dopamine cells called bemdane procell in 12 patients with Parkinson's disease. This was a phase 1 safety study. What did it show? The surgery appeared safe. No tumors were seen. No severe abnormal movements, dyskinesias, were caused by the graft. Brain scans showed increased dopamine activity. Some patients improved in movement scores. This is encouraging. But remember, this was a small safety study. It was not designed to prove that the treatment works long term. A large phase 3 study started in 2025. That is the study we are waiting for. In 2025, a study from Kyoto University in Japan tested dopamine cells made from reprogrammed adult cells. 7 patients were treated. Results showed increased dopamine activity on brain scans, improvement in movement scores, but this was also a small early study. 1 patient improved a lot, which influenced the results. Again, promising, but early. In 2025, a study led by Dr. Mia Shias was published in the journal Movement Disorders. This study tested stem cells from bone marrow given through a vein. This was a phase 2 randomized study. Some patients received 3 infusions, some received placebo. Results showed some improvement in the 3 infusion group. However, the placebo group also improved significantly. 1 treatment group did worse than placebo. This tells us something very important. Parkinson's disease trials often show a strong placebo effect. We must be careful when interpreting small studies. Some clinics claim that when stem cells are injected into a vein, they travel to damaged parts of the brain and repair them. There is no strong human evidence that this happens in Parkinson's disease. Most stem cells injected into a vein become trapped in the lungs. Very few reach the brain. They do not have a guidance system. They do not automatically find damaged dopamine cells. The idea sounds good, but it has not been proven. The United States Food and Drug Administration has clearly stated there are no approved stem cell treatments for Parkinson's disease. The only approved stem cell products are for certain blood diseases. If a clinic is offering stem cells for Parkinson's outside a regulated research study, that treatment is not approved. Several companies are moving forward. The most important study right now is the large phase 3 BlueRock trial. That study includes a comparison group to control for placebo and surgical effects. We are waiting for those results. That trial will tell us whether dopamine cell replacement truly works beyond expectation and placebo. Be careful. If a clinic promises dramatic results, treats many diseases with the same stem cells, charges thousands of dollars, is not part of a regulated research trial, you should be very cautious. Parkinson's disease has a strong placebo effect. Short-term improvement does not mean dopamine cells were replaced. Hope is important, but we need proof. Go to clinicaltrials.gov, type Parkinson's disease and stem cell. You will see all legitimate research studies currently recruiting. That is the safe path. Realistic timeline stem cell brain surgery may become a real treatment in the future, but we still need large randomized controlled blinded studies, long-term results, clear proof of lasting benefit. Realistically, if successful, this may take 10 to 15 years before becoming widely available. This is promising science, but it is not a cure today. Final message. As of 2026, stem cell therapy for Parkinson's disease remains experimental. Dopamine cell replacement is promising, but still being tested. Intravenous stem cell infusions are not proven. Large studies are underway. We are waiting for real evidence. Do not spend large amounts of money on unproven treatments outside research studies. Be hopeful, be informed, be realistic. Science is moving forward, but we must let data guide us. Thank you for watching.